Equity, of course, is a very important topic in any state, and our state in particular. What I'm very excited about is that we have an administration in our state, starting with the governor and the Medicaid leadership, that really recognizes the powerful and important facet of addressing diversity in healthcare delivery. And in particular, we are really now paying attention to people from the LGBT community and collecting information around SOGI data, with sexual orientation, gender identity data. For years, that population has been invisible in the healthcare system, and finally today, we're beginning to make some strides to be able to acknowledge that A, the population exists, and then secondly, we could start to take a look at what their needs are. I am waiting for our state Medicaid department to get the approval on the 1115 waiver to do what's commonly known as the reach-in program for justice-involved individuals. So what this means is when people go to jail or people are incarcerated, they lose their Medicaid eligibility, they lose insurance, they lose lots of stuff. And so while they're in those settings, they still have medical needs, they still have behavioral health issues, they still are sometimes addicted to opioids. So when it comes time for them to be released from a jail or released from a prison, they walk out the door and they have no services. Well now, once this approval comes through, we'll have the ability for people to actually start delivering Medicaid reimbursable services behind the fence. We initially were asking for a 30-day waiver, but after California was approved for a 90-day waiver, our state now is looking at considering moving that to 90 days. Once that takes place, then one of the things that I'm really hopeful for is to get more involved with helping stand up those services in our state that are just desperately needed.